I know it's been a really long time since I've done a video, and I wanted to do this video for a number of reasons. One, because I haven't been on YouTube for a while, and two, because I kind of wanted to document what's going on with me. So the first biggest thing is I'm now actually pregnant. I am 19 weeks and 2 days. The baby is due in September, and as you guys are all aware, we're in the middle of a pandemic right now. So I kind of thought that this would be cool to record everything so that the baby, when he's older, or he or she, because we still don't know yet, when they're older, they can actually see it and see what life is like. But then also I want to talk to a lot of nurses and nurses who are pregnant, because I feel like when I first got pregnant, there wasn't a lot of resources for me to use or people to ask about certain things, unless there were other nurses who were pregnant themselves. So I just wanted to talk about those things. And talking about being pregnant and being a nurse, first, I'm an ICU nurse, so I am in an environment that we have very sick patients. We can be exposed to a lot of things. So being pregnant in general, I think, is a scary situation, just because there's a lot of unknowns and you're always worried about if you're doing something right or something's going wrong. The very first thing that I was concerned about when I became pregnant was, what rooms am I allowed to go into? What isolations do I need to avoid? And the main ones were any kind of droplet or airborne issues. So no TB, no chickenpox. We tried to avoid flu, of course, and anything of that kind of nature. Of course, you always want to make sure you have proper protection. You know, if a patient has hepatitis, Hep C, you always want to make sure you're wearing eye cover. You know, you're gowned appropriately so you don't come in contact with any bodily fluids, blood especially. So there's like a lot of things that you kind of have to be a little bit more cognizant of. Also, other things that I do while I'm in the ICU to protect myself or try to get the least amount of exposure to things is that when I see patients who are about to get x-rays, I will walk to the other side of the hall. I think, I'm not even sure what the general range is, but you know, you don't want to be right outside of the room. Definitely don't want to be inside of the room. Even if they were to provide lead, I still wouldn't feel comfortable with that. So anytime I knew a patient was getting ready to have an x-ray done, I would always move over somewhere else. And then that also goes for patients who are receiving chemo radiation, that if they have any of the implantable medications like the pellets, you definitely want to stay away from that as well, because that can emit radiation. And then that would also go for any kind of their body fluids, urine, feces, blood, anything like that. All of that carries radiation, so you have to make sure you stay away from it and that you don't handle it. And that would also go for medications. There are certain medications that when you're pregnant you shouldn't even handle at all, and a lot of times, because our patients are on vents, we have to give them meds through an OG or an NG tube or the PEG tube, so then the medication has to be crushed. And that is a concern, because when you crush it, then you're releasing fine particles into the air, which you could breathe in, get on your clothes, get into your eyes. So you have to wear necessary protection for that as well. So that means gowns, gloves. A lot of times I double glove, I wear a mask, and I'll wear some kind of eye protective wear. And most of the time, just to be on the safe side, I'll ask pharmacy, is it okay if I'm able to handle it? If it's something that they're like, no, you should just get somebody else, I'll have someone else give my meds, or empty the patient's like Foley or whatever else, just so that I do not come in contact with it. And generally, all of my coworkers have been extremely nice. Nobody ever seems to be bothered by it. They all completely understand. So I think it's just important that you establish a really good relationship with your coworkers, because pregnant or not, you rely on each other. So when you're going through a time that is a little bit more of a special situation, people aren't going to, you know, decline to help you. So I think it's really important that you have a good relationship with everybody. So another issue that I wanted to cover also was dealing with patients that are violent. I think as a nurse, it is a shame that we encounter things like this, but it is something that happens in the job, and it's best to always protect yourself regardless if you're pregnant or not. But generally, as far as it goes for me, my charge nurse or the managers, they always try to make sure patients who have been flagged as violent or have a propensity of having violence, that they wouldn't assign me to that patient. Now, have I gotten patients that could possibly be violent? Yeah. And make sure that you always take the necessary precautions. But regardless of what it is, any patient that you can see that is starting to escalate their behaviors, it is best that you, one, don't get anywhere near arm or feet range for them to hit or kick you, spit at you, or anything like that. Always be near a doorway so that you have a quick exit. And if a patient starts to get aggressive, starts to yell, then just immediately call security. Don't try to de-escalate the situation yourself. Don't bring other people into it. Just call security, because it's better just to protect yourself. Because actually early last year, I was actually tackled by a patient. Now, I wasn't pregnant or anything like that, and it was completely, the patient was known to have aggressive behavior, but I was talking to the patient multiple times before. The patient was fine, the patient was very calm, and then all of a sudden just flipped and then tackled me. But luckily I wasn't hurt, because my friend was actually right behind me, so when I was going backwards, I actually fell back into her, so I didn't fall onto the ground or anything like that. And then there were other workers there that were able to help. So, but just going forward, safety is never anything you want to be lax with. So it is really important that if you feel like a situation is starting to get out of control, that you just remove yourself from that situation, because you don't ever want to put yourself into something where you could get hurt, or possibly your child is hurt, or anything like that, or anyone gets hurt. So always be mindful of patients that are starting to show tendencies of getting upset, so you just avoid them. The second thing that I was worried about was, how am I going to move my patients when I'm pregnant? Because my patients a lot of times are on vents, or they're unable to move. So you can't really just flip and turn patients. I mean, generally you shouldn't do that by yourself anyways, because you want to preserve your back. But you have to be extra careful, because you don't want to put any strain onto your core, onto the baby, or anything like that. So the biggest thing that has been for me is always making sure that I inflate the bed all the way, that I always have help. I normally get at least 2 people to come in to help me, or sometimes they'll even just move the patients themselves because they don't want me to do that. I think the biggest lifesaver that has been for me while being pregnant is honestly my coworkers. They've been absolutely amazing. Anytime they see me getting ready to do anything with a patient that involves like moving their legs, or lifting them, or flipping them onto the side, a lot of times they'll just push me out of the way, and they'll tell me that they're gonna do it themselves, just to make sure that I'm safe. So always be careful with stuff like that. If you're gonna help pull up a patient, trend the patient so that their head is lower than their feet, so that you can get a little bit of gravity to help you move the patient up in bed. If you have any of those rooms that have like the overhead slings that help to turn patients, I would utilize that as well if you don't have enough staff to help you. Another thing while being pregnant, like being worried about things, is like, what kind of vaccinations do I need to get, and what do I get while pregnant, or what do I need to get before becoming pregnant or after getting pregnant? So the most recent thing was I had to get PPD. I recently had a PPD shot back in November. But when I moved over to a new hospital, they have a set time that everyone gets their PPD done. So my one concern was like, because I wasn't pregnant in November when I got it, but I was like, is PPD safe for me to get? And I did ask my doctor, and they said that it is safe, so that I would be able to do that. Another thing is they advise you to get like a flu vaccine during pregnancy as well. And that's something that I always have done since being a nurse, and even before being a nurse, just being in healthcare, I always got the flu vaccine. But this is something that is now becoming more of a thing that my family has to do. My sister had my nephew last year, so she had everyone that came in contact with the baby to get a flu shot, and I will do the same thing as well. Everyone will get flu shots, and also get the DTaP, which is like the pertussis whooping cough one. And then for the grandparents, I'll probably ask them to get a pneumonia vaccination as well, just to be safe, because you just never know what comes in contact, especially now that we're going through a pandemic. I think it's very important that we're very careful about who we let around our children, but then also what protection they take. So if there's people going to be around your baby, then of course you always want them to exercise the normal precautions, washing their hands, hand sanitizer, not kissing the baby's face or anything like that, but the basics, like doing vaccinations as well.
I know.